All right, good afternoon, everyone. Thank you for the love and the encouragement I've been getting so far. This is Mr. Prosper here. So, for the post I made, the last post I made, I got a lot of DMs, people complaining about one or two problems they are having relating to the topic I was talking about. So today I'm going to be talking about delayed period. I'm talking about delayed period. First of all, you have to understand there's a difference between delayed period and irregular period. Irregular period is when the day or the time is expected to come, you are not seeing it or you are not getting it. Right? While delayed period is a month, 2 months, 3 months, you've not seen it. Alright. Now these things are caused by varieties of reasons. They are caused by varieties of factors, they are caused by varieties of other things. But it's very, very important that you know the actual cause. So you don't know if you are at the risk of any medical problem or any medical issue. Now, I don't know where you fall into, if you are having irregular periods or you have a delayed period. This message is for you. And please, when you read this message, when you watch this video, please recommend your friends also if you are also in the same category. In my next video, I'll be talking about some exercises, foods, and some possible drugs that you can use or things that you can do to help your situation. But here in this video, please like, comment, share, and also follow me and subscribe on my YouTube channel also. So let's get to it. Now, we have factors that can bring about this delayed period or irregular periods. But first, let's go into delayed periods. You should first of all note how your period works. You should know how your period works. Okay, when you normally see it, what type of cycle you are observing? Are you a 28-day person? Are you a 30-day person or so? Once you note all this, then things that can bring about changes in your period are stress, physical stress, and mental stress bring about changes in your period. Alright, but then these changes are not that long, they are short-time effects. Then we also have, when you are using contraceptive pills, those of you that used to engage in sex and then you are taking after sex pills and drugs like that, it also affects it. Then we talk about breastfeeding. Maybe you are breastfeeding, alright. Then we talk about weight loss. When there's a drastic weight loss, it also affects it. Then when there's a drastic weight gain, it also affects it. So weight loss affects it, weight gain affects it, stress affects it, and like I said, mental or physical stress affects it. Then we talk about, like I said, when you have pre-menopause syndrome. Okay, when you are about hitting your menopause, it also affects. This one is normal. All right, you are getting to the age of 40, 42, 43, 45, and the rest. Yes, that one is normal. All right. Then we have infection, when you have a particular fungi or bacteria that is in your body. And the funny part about the female system is that the female system is so complex that infection or these diseases can stay longer in their body before they manifest. They stay longer in their body before they manifest. And the longer they stay in the body, the more comfortable and the more they act, the more their action becomes more effective also. And then it tends to affect every part of your body. So infection is also a part of it. All right. Then we have PCOS. That is polycystic ovary syndrome. Polycystic ovary syndrome, that is biological related. I will explain that later in my next video. You understand? All these are various factors that affect or bring about delayed period. Okay. Now, if you fall into such category, before you get to my next video, I will have to tell you to make sure that you know the exact category where you fall in. How long have you seen it? Is it 2 months delay? Is it a 1 month delay? And I would like you to carry out a particular test. Go for a test, a swab test, to test for any particular disease, any particular bacterial infection that you have. When you come back with your result, then you know what to treat. Then also, if you are the one that is engaging in vigorous exercises, try and limit it and see if your period comes back to normal. All right. So, but when you have done and you have made sure that all this, it's not stress, it's not exercise, it's not contraceptive pills, or it's not drugs that you are taking, it's not any natural thing that you are doing that is bringing about it, yet you are still having a delayed period, then, and you have done tests and there's no single fungi or bacteria in body, then and only then we now come to my next video where I will now explain the details and the importance of the polycystic ovary syndrome that I'm talking about. This is biological, this is pure biological now, and then we know how to. There also in the video I'll be explaining some of the things you can do to help yourself, you understand, to stop all this. Don't go and be assuming that it is normal. Some of you go to the hospital to go and complain, you'll be withholding information. You cannot tell the doctor the exact thing that is doing. The doctor can just tell you, don't worry, it's stress, it's just normal stress, it's hormonal imbalance, it's this, is that, because of the information you give them. But you are the one that knows what is really going on. So individuals have different body system. Actually, that is true. Every female have different body system and react to things differently. But you should be very, very much aware that you are not reacting to things differently out of the ordinary. It is natural, all right, before you take your first course of action. All right, so make sure as you are complaining to any physician, any doctor, you give them the exact truth of what is doing you and how they can correct it. Then when you are done and then this thing continues, then you can now follow what I'm going to be teaching in my next video. Thank you and remain blessed. Mr. Prosper.